And it will be hosted by our First Lady Sarah Stitt. Why don't we give her a round of applause? Welcome. She has really taken on the issue of mental health and adverse childhood.
I personally have lived with mental health issues in my family. Both my parents have pretty severe mental health issues. My mother's spawns from a childhood of abuse, and as a teenager she got involved in drugs, trying to kind of self-medicate and different things. She had a very troubled life before she met my dad, so my entire childhood was riddled with things we didn't understand, because back then you didn't talk about those things. You know, there's such a stigma again with mental health issues, but then also abuse, she was so worried about that, if people would judge. And so because of that, it was our little tiny bubble of our secrets.
That today is the beginning of a new day for each of us in this.
We lived in a very poor district, and my dad was uncomfortable. Probably played a little bit into the experience he had in the public school system, and he was scared to allow us to attend public schools. So we were really kind of in our home a lot. And whereas I think in maybe a normal setting, you would leave for 6 or 8 hours a day, and it would give you some relief from that intensive environment. When I was 14, I began to get outside of my box a little bit and spend time with other people that I met and other teenagers. And it was really funny because one day I realized it wasn't normal for your mother to go in a room and not come out for maybe a day or two at a time. And I was at a friend's house, and her mom was interactive and talking to us, and how can I help you, and what do you guys want to do? And I had never experienced that. And not to my mom to be, to discredit her, that was how she was coping. And I did not realize in the environment that I was in that wasn't normal, because it's all I knew. You learn to survive whatever environment you're in. So in the environment we were in, even though it felt very tumultuous and very difficult, it kept her alive against her will a lot of times. And my dad sacrificed a lot for her to try to keep her safe. In his own way, was helping her, but we didn't have the resources. The science wasn't there, the medical practices weren't there when I was younger to get her the proper help. And then my dad has struggled. He had also a little bit difficult of a childhood, and he had mental issues as a teenager that were diagnosed, but never probably really treated properly. And several years ago had a real resurgence of some mental issues, and so he's still in the deep throes of that. And that's really why I decided to focus on this, because over the last 6 or 7 years, I have walked through the system with my dad. I have advocated, I have tried to get him the proper help, and it's been very difficult. And I had resources and time, which a lot of family members do not have. Thankfully, he's in a great support system with a psychiatrist and therapists that are keeping him out of the hospital. He did several years where we just cycled him in and out to try to keep him safe. But he's at a more stable place, which is phenomenal. And it's baby steps. It's hard when you know how he used to be, and he mourns that. Right now, though, he's safe. I feel like he's somewhat stable. He hasn't been in the hospital in a 1.5 or 2 years, which is huge. But, it's still, life is very hard every single day. So I had not really thought through what it was going to look like if Kevin were elected. And I'd had several people say, have you thought about your platform? In the back of my mind, I thought, I really want to talk about mental health, because that's what I was living right then. I think I was still in the campaign. Kevin wasn't inaugurated yet or elected. And my mom took me over to the side and she said, I have an idea. I know what your platform should be. And I said, really, what is it, Mom? And she said, I think it should be mental health. And it was just, to me, kind of just solidifying in my heart what I really felt. And it was kind of her approval that you can do this. Now, it's hard, because when I talk about her life in that manner, it's hard for her to realize that this affected her family and her children very, very much so. And then my dad it is a struggle for him to really wrap his mind around that he does have a problem. And so it's difficult. If you have heart disease or you have cancer, you actively pursue treatment, and everybody around you knows that you have it. And they're able to walk you through that, navigate that with you in a way that's healthy and gets you to a stable place. It's not like that with mental health. You know, we're really good at catching people when they're trying to jump off a bridge and trying to keep them from taking their life, but we're not so good at catching people before they're in a crisis. And I just started thinking pragmatically about the future of Oklahoma and how can we really make an impact on the statistics in our mental health. And it's really taking these new practices and these new sciences, and some of them are not so new, but they've just not been implemented, and bringing them to our children and trying to give our children those tools they need to navigate the life that they have. And I know, you know, for many years, the theory was, well, let's just take them out of that environment and let's just rescue them. You can't rescue every child. And guess what? You can't provide a stable environment for everyone. Every day that I really think about it, I really view my life as a miracle, because my siblings didn't fare so well. And several of my siblings struggled with addiction and anxiety. If I can walk through it, anybody, you don't have to have everybody, the constant support. You can do it. My goal is to use my story and to really focus on this to equip our communities with the support systems we need for our school systems, the faculty that recognizes this, and then also the families, and really focus on children and adolescent, because then 10 years down the road, those children will be the working class of Oklahoma and the next adults, and they will be healthier and better for it.